So guys, how's everybody doing today? So I might have found the perfect parking spot. What do you guys think? Do you think having this view while parked in your car is okay, or what do you guys think? Now let's get closer and have a little chit chat. Hey everyone, how's everybody doing today? Welcome to my favorite spot. And so, as with what's going on with the world, we can really see that the main theme is about resilience, right? And the reason why I'm showing you this view is that I believe that New York City, this island right across me, which used to be just an island full of trees, is one of the most resilient cities in the world, right? Whether it was September 11 or with the closings of, the pandemic, this city is still alive and well. So let's do a little quick chit chat. So, resilience is defined as the ability to recover quickly from difficulty or difficult situations, right? And I can say that the world right now is going through a circumstance that is parallel to maybe the most difficult times in history, right? There's death, suffering, there's extreme financial strain, right? And uncertainty. And this small island in front of you is synonymous with the definition of resilience. Before this island became what it is now, 300 years ago, it was just nothing more than a trading post, right? It was like a port. It was like an empty port, right? Just a forest with a port, right in the financial district, in which the Dutch traders and their ships come in to trade for beaver skins or fur with the Iroquois Indians, right? And every single year, it was able to keep growing commercially and in population until eventually it became what you see today. At nighttime or during sunset, which is basically like the magic hour, the view looks magical. What do you guys think? So guys, the review that we're going to be doing would be tetracyclines. Now, I believe I'm pretty sure I did have done this review a few videos back, but there's something happened with that review in which the screencast just shut down in the middle of the review. Therefore, it only took about maybe the first several minutes of the review. Therefore, I want to go over the whole entire review again and fairly quickly go over it. So if you haven't seen that video, so good for you. You're not missing anything. So we're going to be going over tetracycline, which, as we all know, is a bacteriostatic, and what it does, it inhibits protein synthesis within the susceptible bacteria, right? And the most common drugs that you will most likely encounter in your NCLEX exam would be doxycycline and which is vibramycin, and tetracycline HCl, which is panmycin, okay? Now, let's look at indications for this disease, right? It's usually used as treatment for syphilis, the major STD, syphilis, chlamydia, and gonorrhea. It's also one of the main treatment for anthrax, which is vibramycin, and it's also used as a combination therapy to help eliminate H. pylori, which, as we all know, is a gut bacteria that is the main culprit for causing PUD or peptic ulcer diseases, right? Also, with Lyme disease, tetracycline HCl is also the drug of choice, right? Now, when we're looking at the side effects, we're looking at glossitis, which is basically an inflammation of the tongue or enlargement of the tongue, and it's usually an immune response, right? Or an allergic reaction to the medication, usually. Also dysphagia, difficulty swallowing. Patient can have diarrhea and phototoxic reactions, uh, which is also another reaction, an immune reaction, and causes the patient to have somewhat reaction to the sun actually. So you do have to be mindful about that. And lastly, super infections, which is it's like a second infection imposed by the first infection, and would cause the patient to be resistant to the treatment, right, of the previous therapeutic medication or antibiotic, right? So you do have to be mindful about that. Now, I just want to talk about some nursing considerations. I believe there's an that's the last slide. I'm sorry, guys, but what you have to be aware of and be mindful about with the nursing considerations for this patient taking tetracyclines is that it needs to be taken an hour before or 2 to 3 hours after meals. Okay, and you have to educate the patient, tell the patient that they cannot take tetracyclines with antacids, with milk, or with iron preparations. Okay, now it's very highly nephrotoxic, tetracyclines. Therefore, we do need to monitor our renal function, right, our BUN or creatinine. And the biggest thing that we have to take note in order to take care of our patients and to other patients is to let them know that tetracyclines can lessen the effects of oral contraceptives, right? It lessens the efficacy and the efficiency of oral contraceptives. Therefore, you do need to make sure to tell the patient to use other contraceptive methods in addition to oral contraceptives. Okay, that is a big thing that you might encounter in the NCLEX exam. So that's it for today, guys. I hope you enjoyed the New York City views, the buildings, and a little bit of a history. And definitely, I will be going over other new things. We're gonna have our chit chat talks and going over other issues. Maybe dig deep into trending topics and stuff. So that's it for today, guys. I hope you guys have a blessed day. I wish you guys the best on your NCLEX exam. Thank you. God bless, and make sure to subscribe, and I will check you on the next video. Muchas gracias. Bye bye.